Welcome to Week 3 Mental Health. These are chapters 5 through 7 in your textbook. Again, also you may want to view the videos for assessment on the Evolve website. Mental health. Mental status is the person's emotional and cognitive functioning. Optimal functioning aims towards the simultaneous life satisfaction in work, caring relationships, and within the self. Usually, mental status strikes a balance between good and bad days, allowing the person to function socially and occupationally. A mental disorder, there are significant behavioral or psychological patterns associated with this: distress, possibly disability, impaired functioning, significant risk of pain, disability, or death or loss of freedom is associated with a mental disorder. An organic disorder can be due to a brain disease from a known specific cause. For example, delirium, dementia, alcohol or drug intoxication. I apologize, I can't talk today. And withdrawal. There are also psychiatric mental illnesses. The organic etiology has not yet been established. Possibly anxiety disorder, schizophrenia, some of those with a psychiatric mental illnesses. The mental status assessment documents a dysfunction and determines how that dysfunction affects the patient's self-care in everyday life. The mental status cannot be scrutinized directly like the characteristics of the skin or heart sounds. Its functioning is inferred through assessment of the individual's behaviors, to include not only consciousness, language, mood, and affect, their orientation, their attention, their memory, their abstract reasoning, thought processes, thought content, and their perceptions. And remember, in any system, we always need to be aware of developmental considerations because a child is not going to have the same thought processes and react the same way an adult or an older adult might. So the components of the assessment, those can be some of the things we've already discussed, as well as their appearance, their behavior. Your health history interview may include ABCT, which is appearance, behavior, cognition, and thought processes. You may not always have to complete a full assessment. Your full assessment would include the health history, your objective data, including the appearance and all those things. You'll be able to collect ample data as you go through. Sometimes you don't have to complete a separate mental health exam. Sometimes you can complete this during the health history as you're talking to the patient. If it is necessary to perform a full mental status exam when any abnormality in affect or behavior is discovered and in certain situations. So if their initial screening suggests an anxiety disorder or depression, behavior changes such as memory loss or inappropriate social interaction, you may need to complete that full exam. Substance abuse, these are illicit drug use or alcohol use and abuse. Those things need to be assessed, and there's questionnaires specific for screening women and screening aging adults that are readily used in the settings. There's also lab findings, developmental considerations when you talk about alcohol use or substance abuse. Those things depend on whether it's a teen or an adult or an older adult. Different ages are prone to different things. Domestic violence, you have intimate partner violence, child abuse and neglect, elder abuse and neglect, and the health effects of violence. Just being around it can change the health of your patient. IPV screening, that's one of those things that can be screened for, especially if you suspect abuse or neglect. Patients that are at risk for homicide. And then cultural considerations need to be taken into account for these patients as well.